Hey, are you a pharmacist or in the health and wellness space? If not, you're welcome here too. Maybe you need a little inspiration or motivation. You might be looking to grow your network or collaborate. Maybe you're looking for more in your career. You're ambitious and you want to make a significant impact. I'm Dr. Trish Francetic with my good friends and colleagues, Drs. Kelly Shab and Pana Ninan. We are three Pharm Ds from coast to coast in the US. We appreciate you taking time out of your busy schedule to join us today. If you would, please share this event with your network. If you're watching, that'd be great. Today, we are joined by another Pharm D, Dr. Christine Arseneau. Dr. Arseneau is a mindset mentor, functional medicine health coach, and doctor of pharmacy, specializing in Lyme disease, pain, and complex health challenges. She has 15 years experience in the health and wellness space. And today she'll share about becoming an entrepreneur who thinks outside the box, kind of like all of us, right? After overcoming a lifetime of chronic Lyme disease. So welcome, Dr. Christine.
Thank you. Happy to be here. Excited for this conversation.
We are so excited to have you here.
This is exciting. I'm excited to meet you for the first time, Dr. Christine, and learn more about your story. This is something that you hear a lot about, but I've actually never spoken with anybody personally and heard their story on Lyme disease. So I'm really curious to learn more about this. So tell us, because I think it's kind of incorporated in this story, right? Tell us about this journey from being a pharmacist, because it's 15 years in the health and wellness space, right? From being a pharmacist to what led you to become that entrepreneur and take that leap to start your business.
Yeah. Well, I think, being a pharmacist never really aligned with me. And so in a way, I've always been kind of looking to do something different. I worked in a hospital initially, and even back then I was doing some health coaching on the side. I started my own skincare company. I was always kind of looking for these external things because I never felt completely fulfilled being a pharmacist. And then I had my own personal health. So I found out that I had chronic Lyme disease. I got the diagnosis when I was 29 years old, and I got bit by a tick when I was 9 years old. So it actually took me 20 years before I got a diagnosis.
Wow.
So yeah, at that point I was like completely fatigued, in pain, and like I had all these health issues and I didn't know why. I didn't realize that everything was connected. So I had like a lot of gut issues and skin issues and different things, and like a hospitalization with meningitis, like some big things went wrong. And that's when I really kind of started digging. And that's when I finally got the diagnosis.
Mm-hmm.
So after I got the diagnosis, I actually ended up moving from Michigan to California to be in nicer weather. I switched my focus on my career from a hospital setting to managing an integrative compounding pharmacy, which felt a little bit more aligned because it was a little bit more holistic.
Mm-hmm.
And I really just focused on my health for about 4 years. That's about how long it took for me to fully recover. And then at that point, I knew that I had always wanted to do something other than being a pharmacist. It was like, it never really aligned with me. I always felt like an outsider in my profession because I have always been passionate about holistic health. And so at that point, it was like Lyme disease just made sense. It kept coming in my life. People kept needing help. And I was like, okay, I've had this whole journey. I know so much about this disease. I know how to get better because I did it myself. I know that people need help because the medical system just is not helping people that have the chronic form. If they get bit by a tick, it gets caught right away, it gets treated right away. That's one thing. But a lot of people don't get the bullseye rash. They don't know that they got bit by a tick. They don't know that they have Lyme disease. And these people really need help because even people in the medical system don't understand it, don't know how to treat it. And so it was kind of like, I knew I wanted to start a business, but the exact business kind of found me because it was like, well, this is my calling. This is what I have to do. I have no choice, really.
Yeah, that makes a lot of sense. I think all of us fall into what we're doing based on what we've experienced, and that just makes us better at it. So I feel like Lyme is one of those things where people hear, but they don't pay attention to. There's like you said, there's just like some certain bullet points they understand, and then it's gone. Even in the medical community, there's some resistance, like, well, we don't have ticks in our part of the country. Like, well, yeah, people don't ever leave their boundaries. Ticks know where the state lines end. So anyway, I love that you're helping people. So tell us about your business and how you bring awareness to everybody.
Yeah. Yeah. So I offer health coaching in a really comprehensive way. So I focus on people that have Lyme disease, but also autoimmune issues and pain and fatigue and brain fog, even if they're not exactly sure why. A big part of my program is focusing on decreasing inflammation, because inflammation is the cause of pretty much every chronic disease. So I don't get too caught up in the diagnosis. Hard to diagnose as well. And so some people get stuck in this trap and are not sure what they have. And that almost impedes their healing because they're so focused on trying to get a diagnosis, when really, if we focus on resiliency, if we focus on strengthening the immune system, decreasing inflammation, we're going to help you no matter what you have. So that's really how I focus, is a comprehensive approach, decreasing inflammation naturally. And I do that through using functional medicine principles, looking at supplements that are natural and effective, looking at ancestral habit hacks. So just anything that we can do, any lifestyle changes that are going to be simple, sustainable, and individualized. And it's always comprehensive. So we're looking at stress management and improving sleep and gut health, nutrition, movement, all the things. And then a big part of what I do is mindset and subconscious mind. And so your subconscious mind is really responsible for 90 to 95% of everything that happens in your life. And the conscious mind is responsible for just 5 to 10%. But the conscious mind is still important, because that mindset is something that we live with every day. And the thoughts that we have every day are going to affect our ability to heal. So I do address the mindset, and the conscious mind and the subconscious mind both need to be in agreement in order for you to have the results that you're looking for. So the mindset is important, even though it's a much smaller piece, but where the magic really happens is the subconscious mind. And so that's, I would say, probably what I'm most passionate about and how I help people, because that's kind of like unlocking the magic that just really helps them have the best results.
Yeah. Yeah, that's where it's at. And then people are
Yeah.
like, well, I don't have any problems with my subconscious mind. Well, how do you know? You
Yeah.
don't know, right?
Yeah. Yeah. Because it absorbs everything, like, especially from
Yes.
ages 0 to 7, anything that happened to you, it's just in there. And so, yeah, we have to do a lot of unprogramming, reprogramming.
Yeah, exactly.
Interesting. I like that. I mean, I think that's very important. You know, you can tell them the things to do, but the mind is in so much control too of how we end up feeling. So what is your method of tapping into the subconscious? What's your preferred method for that?
Yeah, so I use mind body techniques that use aspects of hypnotherapy. And so I use something called the Wisdom Center technology. And basically, we just go into the subconscious mind and remove any blocks and obstacles that are in the way of healing. And we can just simply remove them. We don't even have to know what they are. We don't have to relive any traumatic experiences. We just get rid of them. And we do that through speaking to the Wisdom Center, which is essentially, that universal knowledge, your own knowledge plus the universal knowledge. It's basically speaking directly to your subconscious mind, who knows your body better than any doctor ever could.
Wow.
Mm-hmm.
That's deeper than I thought we were going to get. And I love it because it's going to help your health, but it's going to help why they came to you originally. But then there's so many other benefits from it.
Oh, yeah.
There's got to be. Yeah.
Yeah.
So this is your own business, of course. That's what we're all about here at the Unboxed. We're pharmacists, but we also have this other angle to us that's very important. Tell us some of your favorite things about owning a business, and then what might be really challenging.
Yeah, so my thing is definitely the freedom. Like, especially as pharmacists, we are literally stuck in a box. Like the last pharmacy I worked in was like tiny, like you had to like maneuver around your technicians, and like it was just a tiny compact space. And so you're just like literally standing in place all day. And so just having that freedom, that flexibility, I have a lot of birds and animals and puppies. And so just being able to like take breaks throughout the day, get outside, walk the dogs, like it's that flexibility and freedom is just, it's so nice not being, a slave to an employer essentially. And just being able to create your own schedule around, your clients' needs and your lifestyle is just amazing. So that's probably my favorite thing. The
Mhm.
most difficult thing, I would say, it's probably marketing, just marketing in general, because it's not something that we're taught as healthcare practitioners. We're focused on helping clients and how to get results and health, and like that's everything, that we're educated on. So marketing was like a whole new world, and like I know I can help people, but how are the people going to find me that I can help? And so that was definitely a big learning curve.
Yeah, I think all of us can agree with that.
100%.
Yeah.
Yeah, there's a lot on the business side, that you're, again, like you mentioned, like you're not taught that in school. Those aren't the pharmacy book side of things or the functional medicine side of things, right? The knowledge is what we're getting in the schools. And then, to come out and implement, there's all those hurdles. But I agree with you on the freedoms of time and being able to do what organize your schedule, get outside, all of that, which is so important for your health too.
Yeah. I could take a yoga break in the middle of the day and like really live what I teach others,
Yes.
take that time for myself.
Exactly. Practice what you preach also. That's
Yeah.
a good. So what about through your business as you've, had clients, or do you have any fun stories or inspiring stories that you'd like to share with us?
Yeah, sure. Let's see. So one client, we were able to overcome his brain fog in just 3 weeks, just by making some tweaks with the supplements and a couple of lifestyle changes. And, like Kelly said, like this work can impact different areas of your life. So it was like, we got on top of his health issues so quickly that we were then moving on to helping him with his business. And I typically work with people in a minimum of 3-month segments because they do have these, chronic complex issues. But it was like his health issues were so much better that he wanted to focus on growing his business and putting himself out there, and his scarcity mindset and all these other things. So it's, yes, I'm an expert in health. That's my focus. But when you help somebody with their health, you're helping them with their career and their relationships and all these other things. So I think that's always a huge win when I can help people in multiple aspects of their life.
Yeah.
Man, that kind of brings chills, doesn't it?
It's true though, because your health and everything, it's all interconnected too, and how if you're thriving there, you thrive in other places.
Mhm.
I believe
Yeah.
Sorry.
And when you feel good, you start thinking about all the other things you can do with your life and with yourself, because you feel good and like you're really participating in your life again in a better way, different way.
Yeah.
Yeah. So do you have any exciting new projects you're working on or planning for the future?
Just really revamping my programs the way, like I recently kind of revamped and added a group component so that I find that clients learn better in community. We all heal in community. And so listening to other people's questions, learning from other people's experiences, it really helps to kind of cement in the concepts that I'm teaching. So that was kind of my latest project, is just really revamping everything. And it's an ongoing thing because I'm always learning from my clients, adding things that are benefiting them, maybe taking things away to simplify, because you don't want to overwhelm somebody with information. You want to give them just what they need so they have those next action steps so they can keep moving forward as quickly as possible. So it's always a process of just perfecting things as you go.
Oh, yeah. I agree.
Yeah, I think it's always an evolving thing on where you're at in life and the things that you're seeing and experiencing, and that allows you to help others in new ways, which is definitely true. For any aspiring entrepreneurs out there, do you have any advice for them, Dr. Christine, on, they're considering starting a business, or, they're trying to get going? Like, what advice would you give them?
Just do it. Like, we get stuck in what I like to call procrastinating, where we're just like taking all these courses, learning how to do it, never feeling like we're ready. but the secret is that you're never ready. So you just have to act, and the clarity comes with the action. So, I mean, you do want to do some planning. You don't want to just like act when you have no idea what your goal is, what you're moving toward, but you know, plan, then you do, then you review, and then you just keep doing that. And so you keep tweaking and planning, doing, but the doing is the most important piece, because that's like what really speeds you up. That's where you're going to get your clarity. So yeah, I would say just take action.
I like that. Plan, review, and do. Is that what that was?
Yeah.
And do, and then review.
Yeah.
Yeah.
Plan, do, review.
I
Yeah.
like that.
I'm going to do that today. Yeah. No, it's true though. A lot of us probably could have started earlier than we actually did because we want to perfect it. But there's really no perfecting until you have the experience of actually doing it and seeing what it feels like and how it relates to you as a business, and then the client as well. It's just an ever evolving process. So start early. Really does help.
Mhm.
All right. Well, we're wrapping up here with time. Is there anything else you'd like to share?
I would just say, like, to remember that your thoughts and your emotions create your reality. And so we tend to limit ourselves and put ourselves in these boxes and think that, well, I'm a pharmacist, this is all I can do, or, you know, especially I've spent so much money, so much time earning my degree. So we tend to limit ourselves, but it's really just in our mind. And so if we can change those thoughts, those inner beliefs, then our outside world changes. And so just remembering that we actually have a lot of power to create our reality, and we don't have to be stuck, and we don't have to listen to people that try to keep us in our box either. That, like, with this journey, a lot of times you kind of find new circles, new colleagues. It really helps to get support from people who are doing what you're doing, because this isn't made for everybody. Not everybody can be an entrepreneur. It does, you know, it feels risky. It feels unsure. You have to really know your why and know where you're going and have that confidence in yourself. And so it does take changing some things, like the people in your environment, to get there.
Oh, this is so good. Such sage advice. I love it.
Yeah, I like that a lot. I think that just really resonates, I think, with a lot of people. So where can listeners find you? Where can they find out more about you and your business? I know you're going to be on LinkedIn, obviously. So anybody who's watching, listening, seeing the replay needs to make sure that they reach out and connect with Dr. Christine. But where else can we find you?
Yeah, so LinkedIn here and Facebook, I'm under my nickname Tina. So Tina Arseneau on Facebook. I also have a YouTube channel under Lyme Support, my business, and lymesupport.com is my website. And then I actually also have a quiz to see how inflamed you are. So if somebody wants to take advantage of that quiz, after you take the quiz, you'll get a mind-body meditation to reduce stress, because stress and thoughts and emotions all affect how inflamed we are. So the link for that quiz, if anybody wants to take that, it's pain-away.info/quiz.
Okay. We need to put that in the chat here. We can drop your links in there too. Do the YouTube channel, and then make sure that people, I want to take the quiz.
I know, I want to take the quiz too.
I think it's a great idea. You just get curious. You're like, oh, I wonder what it would say for me. And then I think we could always use a good, you know, meditation and mindset like thing to listen to.
Yeah, absolutely. Awesome. Well, we're going to drop all that stuff in the chat, and we're going to wrap it up today. Unless anybody has anything else they want to say, we're going to wrap it up.
No, thank you for sharing your story, though. I appreciate everything and hearing it. I've never heard everything about the Lyme disease, and, you know, just how I didn't realize, you know, I think people chalk it up to, oh, it's just, you know, not a big deal, but I didn't realize how chronic Lyme disease, how much it can affect people, and it's kind of unknown. Like they're not really.
Yeah, it's different for everybody, right? I mean, it's just however it's based on your immune system, and how it presents is different, right?
Yeah, so that's one of the tricky things about it and getting the diagnosis is it's known as the great imitator. So the Lyme bacteria, it's this little corkscrew shape, and it can bore into various tissues. So sometimes it bores into your joints and you get joint pain. Sometimes it bores into your brain, you get neuro symptoms. It can bore into your heart and cause issues there. So it can present in all these different ways. And then the other thing is the tick is known as the dirty needle of nature. It's jumping from one animal to another. So it picks up more than just Lyme disease. It picks up various parasites, bacteria, viruses. So it's never just one thing. And so usually you have Lyme disease, but you also have like a couple of other bacteria. And then as those infections start to get worse and worse, then your body's more prone to opportunistic infections. So then you start picking up even more infections. So like by the time I was diagnosed, I had like probably like 10 different like viruses, bacteria, parasites in my body. And that was why I was so extremely, extremely fatigued because it all, if you don't catch it early, then you just start collecting all these other infections. So that's something that people don't fully grasp.
Does
Yeah,
everyone,
go ahead. Go ahead, Trish.
does everyone get that bullseye rash?
So that's the other thing is only maybe 30 to 50% of people actually get the bullseye rash. And then, if the rash is like on your back or something, you might not even see it.
Right.
And then there's this whole other world of the potential for it to be sexually transmitted that not all healthcare practitioners agree that it is, but some studies have shown that it is. I commonly see people who have more than one family member affected, like a wife and a husband and a kid or two. And, there's that piece of like, oh, well, a family is going to hike together, camp together, do all the things that put you more at risk for getting the tick. But then, potentially it's sexually transmitted as well. And then it's definitely transmitted through the placenta during childbirth.
So one more question. I'm sorry. I've got all these questions now.
I
So,
know.
and it just left me. It just completely left me. So is there anything to test for this? Is there a test if you suspect that you might have Lyme disease, and how do you get your doctor to test for that?
So that's the other thing that's tricky. It's like every single thing with this disease is like tricky, convoluted, not clear cut. And that's the issue, and controversial, and there's different opinions. So the testing, if you go to just your primary care doctor, they're going to do the ELISA test first, and that's a screening test. The problem is it doesn't meet the definition of a screening test. It's not specific enough. So if that's negative, they don't look further, but it misses a lot of people. And then the Western blot would be the second step of that. Again, that's not very reliable for multiple reasons. There's a lot of different strains of Borrelia, the bacteria that causes Lyme, and it's only looking at one. So if you got it in Europe or somewhere else, it's not going to be positive. So there are tests like IGeneX, Armin Labs that are more comprehensive. They are pricier, and they're only ordered typically by what we call Lyme literate doctors, somebody that is very familiar with Lyme disease and treats these chronic forms of it.
Do you do testing for it?
I don't actually, because I've found that I really just focus on building resiliency in the body. And when I've thought about, oh, maybe I'll expand and order tests for patients as well. But I find when people get fixated on the tests, they get really fixated on the physical body and on the diagnosis and on that test results. And it almost impedes their healing, because one of the things about healing is you can't be really identified with your diagnosis. You kind of have to create a new identity and jump into that new identity and to no longer be the sick version. And when they get really, honed in on the test results and everything, it's like, I have Lyme disease, I have Bartonella, and it like, the more you say I am and I have, the more closely identified you become with your diagnosis. And so I focus on, decreasing inflammation, building resiliency in your body, and kind of separating from the diagnosis and becoming that new version.
Yeah. And that's something you and I both do. We just help people create that new identity.
Yeah.
And yeah, absolutely. I love it.
Yeah.
Did anyone else have any questions? This has been awesome.
Yeah, but thank you.
Yeah. Thank you.
So informative, Dr. Christine. It's been so much fun talking with you today. And thanks for sharing all about you and your business. You're inspiring. And I know that this, your story is going to motivate other pharmacists to join this movement and just take action. So for all of you watching, let us know in the chat or send any of us a DM. What did you like about today's episode? Reach out to Dr. Christine Arseneau. If you're interested in being our guest to share your story and showcase your brilliance, please reach out. We would love to chat with you. Fill out that application link in our featured section. Thank you so much for joining us today. Thank you, Dr. Christine. And we are all about inspiration, building relationships, and networking around here. And we don't play small, y'all. We are on fire. So we will see you all next week.
Bye, ladies.
Bye, guys.
Bye.